Dr. KRISHNAKUMAR. I work as a consultant interventional cardiologist at PRS Hospital, Trivandrum. In the last episode, we talked about the major health hazard of this decade, coronary artery disease, and what we should do to prevent it. Now, once we have an episode of a coronary artery disease, it's not an episode, it's a presentation of coronary artery disease, either as chest discomfort, breathing difficulty. What are the treatment options? Now, what is most essential is, first of all, a correct diagnosis. The correct diagnosis comes from a combination of an ECG, blood test, and certain non-invasive tests like an echocardiogram and a treadmill. Now, once we have a high degree of suspicion from these tests, the cornerstone of diagnosis of coronary artery disease is a coronary angiogram. Now, majority of the times we have the capacity to do this through the radial procedure, that's a right radial artery, that is a day-care procedure where it is done through the right hand. We can find out blocks in the blood vessels, and depending on the blocks, the location, extent of these blocks in the blood vessels, we can go for further treatment of coronary artery disease. Now, when you consider treatment of coronary artery disease, all minor forms of coronary artery disease, that is blocks up to 60 to 70% occlusions, can be treated with medicines. We have very good blood thinners and cholesterol lowering medications which help to prevent progression of disease, and we can very well go on these medications without doing any coronary interventions. When the occlusion is more than 70%, then only we need to go for some kind of interventions, which could be an angioplasty or a bypass surgery. Now, this distinction, that is which form of treatment we generally go to, depends upon the extent of blocks, the length of blocks, and multiple factors. If there are multiple blocks, multiple blood vessels, long blocks, long occlusions, then we go for a bypass surgery. If there are small blocks which can be corrected with stents, then we actually go with an angioplasty. But understand again, as I said in the previous episode, prevention is better than cure, because once you have coronary artery disease, then the treatment usually becomes a lifelong process. Thank you.